good evening. Today is Saturday, February 15th. My name is Gabriela Sanchez. We're in week 5 of school. We're going to be going over the axial skeleton and the appendicular skeleton. In the past, I wasn't using any notes, but it's a lot of stuff that we need to point out. I don't want to forget anything. We're going to start with the axial skeleton and we're going to start with the anterior skull. So to look into the anterior skull, the first and foremost would be the frontal bone, which is right in front, the nasal bone, which is right in this area. The sphenoid would be deep inside like the eye, or like behind the eye. You have the lacrimal bone, which is right at the edge here of the eye, and right behind that would be the ethmoid bone. The zygomatic would be in this area here. Maxilla is the top portion of the mouth, and then the mandible is the bottom part of the mouth. The last one, the vomer, is this little bone right here, like kind of, I would think it's kind of like cartilage. I would assume it's kind of thin. Moving down to the posterior skull, we have to turn him around. Posterior skull, you could see the mandible from the posterior view, which would be right here. The occipital would be right in this area. The parietal would be here on the sides. And the temporal is right in this area here. Now for the lateral skull, so now we're going to look at the skull on the lateral view, which is on the side. So we're kind of going over the same bones. The ethmoid is right behind the lacrimal, so it would be right here. So lacrimal would be first, the ethmoid would be right behind it. Frontal is right in this area. Mandible is this area here. Maxilla, again, it's the top portion of it. And since we're looking at the side view, you're able to see it this way. So the mandible, the maxilla, the nasal would be the nose right here. Occipital is the back of the head right here. Parietal would be right here. And then temporal and the zygomatic would be right in this area here. The inferior skull, that means we're going to have to pop the skull open. And we start with the ethmoid. Ethmoid would be right in here. The frontal would be this bone right here, the frontal. The parietal would be the sides. Occipital is back here. The sphenoid is right in this area, and the temporal would be on the sides here. Now going to the vertebral column, the atlas is the very first one, would be considered C1. Axis would be C2, and the cervical vertebrae would be Cs 1 through 7, which is kind of around this area right here. Next would be the thoracic vertebrae, which would be 12 of them. So going down over here, kind of around here. And then you have the lumbar vertebrae, which is the remaining 5. The sacrum is in this area, and this curved bone in the bottom, that's the coccyx. That's called the coccyx. So we have the cervical, the thoracic, the lumbar, the sacrum, and the coccyx. Now going back to the anterior view, you have the thoracic cage. We'll start with the manubrium of the sternum. So this is the sternum, the body of the sternum. The manubrium is this top portion of it. The body of the sternum is this longer portion that kind of goes down. You have what you call the true ribs, the false ribs, and the floating ribs. The true ribs are the ones that connect from the vertebrae all the way around to the sternum. So you have 1, 2, 3, it's 7 of them that connect from the vertebrae to the sternum. The false ribs would be the ones that do connect kind of to the, they kind of merge in with the 7th rib, and it eventually does kind of merge in and touch the sternum. The floating ribs is just that. They're floating. They're not connected to anything. They're not connected. except to the vertebrae, it doesn't wrap around completely to the sternum. So that's are the true ribs, the false ribs, and the floating ribs. So that's it for the axial skeleton. But now we're going to do the appendicular skeleton, which consists of the pectoral girdle and the upper extremities. So the scapula, you could see it from the anterior view. It's a little hard to see. It's right back here. If you turn it around, this is the scapula. Clavicle is this area right here. You have the humerus and the radius and the ulna. I always get them confused, but I know that the radius is the thicker one, and then the ulna is the thinner one. So those are the upper extremities and the pectoral girdle. The hand and the wrist. This is a little complicated. It's hard to see. But I'm going to try and go over them. I know that there are 11 of them that I have to review. I'm going to start with the little tiny bones that are right in this area. So the very first one is the pemphoris, and then after the pemphoris is the trispectrium. The lunate is right in the middle, right in this area, and then you have the sphenoid. After the sphenoid, you kind of go down to this area. Then you have the trapezium, you have the trapezoid, you have the capitate and the hamate. So those are 8 right here. The metatarsals are the ones like all across here. And the phalanges, which are the kind of the distal part of the hand, the fingers. Those are the phalanges. And the last one, the sesamoid, is this joint that's right in this, in kind of like the thumb joint. That's the sesamoid bone. Moving down to the pelvic girdle and the lower lumbar, that would be, we could start with the ilium, which is right in this area here. You have the ischium, which is in this area here. The pubic bone, the pubic bone's right here. Moving down to the lower extremities, you have the femur right here. You have the patella, which covers the kneecap. Sorry, I almost dropped my skeleton. Patella, you have the tibia and the fibula. I confuse those two, but I know I kind of, fibula, flimsy, the smaller ones, fibula. Tibia is the thicker one. Moving on, lastly, to the ankle and the foot. Calcaneus is the heel bone right in this area. You have the cuboid. These are kind of like the hand. These are, I apologize again, I almost dropped that. These are kind of like the hand. You have the cuboid, which is the very first one here. You have, now you have the intermediate, the medial, and the lateral cuneiform. The lateral would be obviously the one that's next to the cuboid. The intermediate would be the one in the middle. The medial, because it's closer to the medial line, would be the last one here. So those are the 3 cuneiforms. The metatarsals are right in this area here. Those are the metatarsals. The phalanges are here. And then you have the navicular, which is right above all those little bones, and then the talus, which is like the ankle bone. So those are the bones of the ankles and feet. I think that concludes my video. A lot of things to point out. I think I covered them all. Again, my name is Gabriela Sanchez, going over the axial and appendicular skeleton. Thanks.